Hi, everyone. This is Sean with the MassSupport Network, here with your COVID-19 update for Friday, October 23rd, 2020. So, looking at the trends worldwide, we saw another 2.8 million cases in the last week, which is the highest it has ever been. Yesterday was the highest single day for cases in the world, new cases. That's about 2.8 million in the last week, which is about 500,000 more than it was the week before. Similarly, here in the US, we saw about 435,000 new cases in the last week, which is about 55,000 more than it was the week before. And yesterday was, a lot of places are saying it's the highest it's been since midsummer. That's kind of a misleading statistic because it was actually the second or third highest day for cases in the US ever. So we're really back up there now. Here in Massachusetts, we also saw quite a lot. Our highest single day highest increase in a while. So we saw 5.6 thousand new cases in the last week, and yesterday was also the highest we've seen since like May at least. At this point, it's kind of hard for on the state level to find it as easily. But moving on to deaths, we're also starting to see things trend upwards here. That was 40,000 new deaths around the world, which is about 5,000 more than it was last week. 6,000 in the US, which is starting to trend upward again, about 1,000 more than last week. And here in Massachusetts, we saw about 138 deaths in the last week, which is a spike from last week when it was in the 80s. Again, when deaths are that low, one bad week can seem like a big increase when it otherwise isn't, but we'll see. So also in terms of cases where we are right now, since we have crossed 40 million cases worldwide, in the time it took to get from the first COVID case to the 10 millionth was 176 days. To get from 10 million to 20 million was 44 days. To get from 20 million to 30 million was 37 days. And from 30 million to 40 million was 31 days. That's something to remember there, because while we talk about waves and surges in the country, worldwide it's only ever been an upward trend. And now let's take a look at things more visually here. This is the COVID tracking projects update from yesterday. Looking a little blurry today for some reason. But tests continue to be high, perhaps slightly plateaued there, but daily case counts are going up. You can see there pretty clearly on the line that we've only had 2 days higher, and some counts actually put that higher than the second one there. But there's 2 high spikes in July of the highest days we've ever had, and we are right up there with them right now. In terms of hospitalizations, we're also steadily on the uptick here. It's been a while since we've been at that level. And then deaths, we have seen another uptick there, and we'll show that more closely in a second. So just here's one more closer in look at case count, so you can better see where we're at right now. And see that we're heading for some new heights there. I would not be surprised at all if we exceed our former July height there, right? In terms of deaths, it's really being driven by the Midwest. Just about everywhere is level or trending up right now, but the Midwest has seen a steady spike in the last few weeks, especially the last couple of days. There's been a very sharp increase there. So that's where deaths are coming from. And now this next slide is one that I try out every couple of weeks. I want to explain it before I click over to it. So this is the chart of the week when a state had its highest single day of new cases. So It's going to show when the most new cases were recorded in that state by week. And when places surge, they move along in the chart as they keep hitting their new highest part, and places that have done better tend to be left towards the earlier part. So let's take a look at where this is right now. So as you can see, unfortunately, there's a lot of places that have reached their highest case count in the last month, just showing how the surge is going. And a lot of them, that was just last week. So it's, you know, that's a lot of places in the West and Midwest that are really, I mean, peaking is the wrong word because they're surging and are probably still, a lot of them, on their trending upwards. Whereas you can see some places like Texas and Florida, which were the big drivers of the summer surge, along with California there, hit their peaks back then. But now it's not just in one specific area. We've got basically places all around the country that are hitting their highest parts, from places like Wisconsin, which has been steadily one of the hardest hit, North Dakota, the Midwest, but then also places like Montana, Utah, Wyoming. There's a lot of rural spread right now, which is very fortunate because there's much less services in the rural areas. All right, so that cheery note, let's move on to developments. A couple of things happened in the last week. First of all, the FDA formally approved remdesivir. It's no longer on emergency use authorization. It's been approved. It is, however, as many people say, it's not a game-changing drug. It is a moderate help. It reduces hospitalization time. It has not shown to have a significant impact on reducing deaths patients directly anyway. However, anything that reduces hospital stay will reduce the strain on hospital resources, so it may indirectly reduce deaths just by people who are not taking up hospital beds as long, meaning other people can get those services. Also, the CDC expanded its definition of close contact for COVID exposure. So it used to be 15 minutes or more within 6 feet of someone, but now it's 15 minutes or more total over a 24-hour period within 6 feet of someone. So this is actually following a specific instance in Vermont over the summer where there was a prison guard who became infected following several interactions with infected inmates, but none that were over 15 minutes, but they were just all short minute or two interactions that, you know, added up to like 17 minutes total overall. They were able to go back, because it was a prison, they were able to look at the security footage and see like how much time he had spent interacting with each of these people and total it up. So it seems that it's not just like a prolonged exposure, but a series of short exposures can do the same. So that will, hopefully it's more guidance just for us to look at for our own safety. That's also going to be difficult for contact tracing purposes though, because getting people to remember, you know, who have you spent more than 15 minutes with is relatively easy, but, you know, who have you spent several short 15 minutes with is a little bit harder. And it means that there are probably a lot more exposures by that definition. Speaking of contact tracing, North Dakota has stopped theirs. Basically, they are per capita the most heavily affected state right now. And essentially, there are just too many cases right now for their contact tracers to keep up with. So the state basically pulled their, they had National Guard doing contact tracing. They pulled them off to help with some of the backlog in testing, and have basically told people, if you test positive, call your contacts yourself. This is one of the issues with contact tracing is in a full widespread outbreak, it just can't keep up with the number of cases. So it will rapidly fall behind and not become useful anymore. Contact tracing is best when you can really stay on top of the disease. And if you can't, it's just not going to work. So that's rather unfortunate there. Of course, some would say also, if you dedicate adequate resources to contact tracing, if you have enough people on it, you should be able to stay on top of it. And if you don't have enough contact tracers, the disease is more likely to get to that point. And finally, no, mouthwash will not stop COVID. There was a study going around talking about how mouthwash had been used to inactivate coronaviruses in a petri dish, basically. But it's worth noting that, and so many people spread this around to say like, oh, you can use mouthwash to protect yourself from COVID? No, for several reasons. First of all, the study was not done on SARS-CoV-2, the actual coronavirus in question that causes COVID-19. It was done on other coronavirus family viruses. The study authors kind of offhandedly said, hey, maybe this could work on a coronavirus too, on COVID too, but did not actually do any study on that. Second, so sure, an alcohol solution can break up the lipid envelope that makes up a coronavirus, but there's so many things wrong with it though. You can't, it's just assuming that at any given moment, all the virus is just in your mouth. A lot of the virus that you'd be exposed to would enter through your nose or would already move down into your lungs. There's places, pockets that it could hide out. They did the study in Petri dishes, basically, not inside a human mouth, which has a bunch of nooks and crannies and also other bacteria. And mouthwashes aren't really antivirals. It's just that if they're basically alcohol-y enough to dissolve it. So this isn't something, and also to try to think of the timing, when in your day would you use mouthwash that would immediately post exposure, or you're just doing it regularly? Don't think about it too hard. It's not a good idea. All right, so you can find the stats and trends on the usual sources, COVID tracking, New York Times, mass.gov. I'll point out that depending on where you look today, you may find different numbers on if yesterday was the second or third highest day. New York Times says second, Washington Post, COVID tracking project say third. There's a couple of other places you could see, but it is definitely one of the top three, no question there. And of course, mass.gov for the Massachusetts-based statistics. And for more of the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.